Hi, I'm Dr. Ayyappan, consultant gastroenterologist. Diet in patients with inflammatory bowel disease, that is ulcerative colitis and Crohn's disease, is often a neglected topic. Emerging evidence shows that a diet plays an important role in the pathogenesis as well as control of the disease activity. Studies in Japan have shown that as the Japanese population started adopting a more Western style diet with more of red meat, the incidence of ulcerative colitis started increasing. The studies in Asian immigrants to Western countries have shown that as they started adopting a Western style diet, the incidence of inflammatory bowel disease started increasing. So, multiple studies have shown that predominantly Western diet, which includes a lot of ultra processed foods as well as red meat, is a risk factor for inflammatory bowel disease. One study particularly looked at the use of sugar-sweetened beverages in the disease activity of ulcerative colitis, and which found that the continuous use of sugar-sweetened beverages increases the risk of hospitalization in patients with ulcerative colitis. And also studies have shown that the artificial components in ultra processed diet like sorbitol and saccharin increases the disease activity of ulcerative colitis. Increased salt content in the processed foods also can be a risk factor for increasing the inflammation. It has been shown in some studies. A diet which is consistently recommended for patients with ulcerative colitis and Crohn's disease is the Mediterranean diet. This is a diet which is based on whole grains, fruits, vegetables, nuts, and olive oil. We can include fish and chicken. And what should be reduced to a minimum is red meat and processed meat as well as ultra processed beverages. We can include milk in small amounts, and it's also important to maintain adequate physical activity. Thank you so much for listening.